The World Health Organization is pulling back, banning, suspending hydroxychloroquine. When I heard that, when I saw that, I really suspected that there was a political motive afoot. I know they had a study. We had some doctors on last night who said, no, that's perfectly fine. Yeah, we understand. But I don't think you do. Tell me your thoughts. World Health Organization abandoning hydroxychloroquine.
The amount of effort and time that's being spent to destroy hydroxychloroquine is beyond imagination. Now, I don't know whether or not 100% this medication is going to be the cure for COVID virus, but I think we need to give it a chance, and we need much better studies than that was published in Lancet. This was an observational study that, with the data coming from many different continents, including China, and the data is very much biased. And it's not a real investigation. It's not a prospective, randomized, the way we want this study to be done. And so you're looking at about 90,000 people, 15,000 in the treatment, and a lot more in the control. And they also admit themselves that there's a lot of shortcoming in this. And when you have an observational study, Greg, you can never say it's a cause and effect. For example, they claim that medication can cause heart disease and can cause more heart attacks. You cannot make those statements because it's an observational study. So for a lot of doctors to go and say this was okay, or even bigger than that, for World Health Organization, who is supposed to be a medical society, a medical organization, not a political one, to stop all of their studies based on this is really embarrassing. If anything, we need WHO now more than any other time to do a better studies for us to get the answers. Whether it's hydroxychloroquine, whether it's remdesivir or ivermectin or any other antiviral medication, the goal of the president is to save lives. Nobody's banking on any medication. We have a pandemic. We want to save lives. We want to open up our economy. So I think this was a disservice. First of all, I was very surprised that this study was even published in Lancet. So, it's a big surprise for WHO to stop their studies. And whether or not they have a political agenda, certainly the person who is running the head of WHO seems to be a much bigger politician than emphasis on science right now, and this is disappointing.
Well, I just got an idea while you were talking. Term 2, you, Surgeon General of the United States. I'm serious. That would be perfect. You get it. You got great political savvy, and obviously you know the medicine. Just a thought.
I would be happy to support.